In recent years, the county's response to the needs of those struggling with mental illness and emotional crisis has evolved considerably. We've made important strides with our mental health crisis team and other strategies to respond quickly to those who need help. With a focus on early intervention and coordination of care, this approach is having positive results and is keeping mentally ill people out of our jail and better supported in the community. But still, there are gaps in the system of care.
For those who are in trauma or have some warning signs that crisis is imminent, there are only a few options to receive timely interventions. Often these individuals call 911 or go to a hospital for help. People experiencing mental health symptoms may come into contact with law enforcement due to being disruptive in the community. Unfortunately, this can lead to those individuals being arrested and taken to jail, but what they really need is help. In the fall of 2014, the Washington County Mental Health Program began working with our community partners to assess the system and identify the gaps in the mental health support network. That work led us to focus on the creation of a specialized mental health assessment and triage center. Based on an urgent care walk-in model, it will help people who are in crisis avoid going to the hospital or to jail. During the planning phases of this project, we've taken the approach of actively engaging our stakeholders, including mental health providers, hospitals, emergency and first responders, schools, and consumers of mental health services, as well as their family members. We are especially focused on designing the program and the facility in a way that avoids adding trauma to those who are seeking help and provides a space that is welcoming, respectful, and safe. The Mental Health Urgent Care Center will be a place where people can go, in crisis or not, just like a physical urgent care, where they can receive crisis counseling, information and referral, treatment connection, and other types of supportive care, including the active involvement of peers, which can be helpful in the healing process.
Recovery is a very personal, very personal journey. Everyone defines recovery in a different way. We've all had different experiences in our lives. So as a peer, we share those experiences. We talk about what it means to them and what it means to me, and I might share some of my experiences, but the ultimate goal is to help a person recognize they're not alone. And learn together. I learn as much from my peers as maybe they'll learn from me what my coping strategies in recovery have been. And it's not just alcohol, it's also the mental health. When you put the two of those together, sometimes it's a battlefield of the mind. And it's very difficult without knowing that there's other people available or out there. It's easy to get lost in the system. Right now in Washington County, a lot of my peers, the only way that they've made it into the system is either through law enforcement contact or through having to go to the hospital or the emergency room. Having the urgent care clinic available gives somebody a softer way into the mental health arena. You've got people who are going to sit and listen, who are going to guide them through without having contact with the sheriff's department or the police department, or having to go to the ED. Both of those are very traumatizing in a lot of different ways. So having a safe, warm handoff, so to speak, where people from law enforcement can bring an individual who may be struggling and know that this is a safe place to be dropped off at.
We are on track to achieve our goal to open in 2017 and have begun actively searching for a facility that meets our location and program needs, such as close proximity to public transportation. Reflecting back over many years when there were very few resources to help those suffering with mental illness, we now have a great opportunity to support members of the community who are in great need and help them find a path to healing.